Hi, I'm Nancy Hireman.
And I'm Brenda. We're two registered hospice nurses, and today we're going to show you how to move somebody from their back in this nice comfortable position onto their side in a comfortable position. And the reason that's so important is we want to prevent bed sores and pressure sores from laying in one position too long. The skin will lose its oxygen and get sore and uncomfortable.
How long do we have to do that? How often do we have to do that?
We have to do that during the day, every 2 to 3 hours, and as needed if they get in a poor position, and at least once or twice during the night. Because as our bodies are slowing down, the circulation is slowing down, and bed sores or pressure sores can be very uncomfortable.
Notice how comfortable Dan is right now. This is the appropriate position for being on his back. He's really well supported with pillows.
Right. So now we want to move him to his side. So the first thing Nancy's going to do is she's going to raise the bed height. Luckily we have an electric bed here. Oftentimes you'll have a crank down here at the bottom, and so getting the bed at the height that you want.
That's going to protect my back.
Exactly. Okay, so
I'm going to tell Dan too, of course, what I'm going to
exactly.
do. So he
The whole
isn't
time
surprised by it. So Dan, I'm also going to put your head completely flat. I'm going to flatten out the bed, so you're going to feel it going down.
And we already have our pillows gathered. We have 3 pillows here. So now Nancy's going to decide which way she wants Dan to turn.
I'm going to turn Dan towards the camera.
Okay. So now she's going to pull the pillows out and gather them where she can reach them easily. And notice she's putting them on the side where she's going to turn them, where she's doing all of her work. And she's going to stay on the side in which she's going to turn him toward. Okay. First thing is she's going to bend the far knee.
Pull him towards me. I'm going to pull him towards me.
Now, watch her. She rolls that in. Anytime you use the draw sheet, get it nice and close to the body. Look at her stance, okay? And now she's going to pull towards her. There.
The reason I did that is so that when I actually get Dan turned on his side, he's not going to have his face in the railing or be right on the edge of the bed.
Okay? So now, the side that she wants him to turn to, she's going to raise the opposite knee.
So it's always easier on your own body to pull. You're much stronger than to push a patient. So come to the other side, so you're going to use your muscles to pull. I'm going to go ahead.
Yep, she's going to bend that knee, and she's going to take one of these extra pillows and she's going to put it in between his legs and in between his knees, right there. And then when he turns, you'll see how that's going to be more comfortable.
Notice that I also brought his arm away from his side, so when he turns, it's not right underneath him.
Now, she's going to take the shoulder, there you go, and she put the arm across there. And again, she rolls the sheet up and she rolls him toward his side. There. And now she's going to hold on to that sheet. She's going to take that spare pillow and she's going to tuck it in behind him.
And if you kind of roll it towards him, then it bolsters it. And of course, now you have an opportunity to really flatten out that sheet. Get rid of all the wrinkles on their clothing so that they're getting a little back rub if you've got it.
It's an excellent time. It's a great time to look and see if there's any skin breakdown, and it's just a good time to really look at them, touch them.
Then of course you want to adjust that pillow in the front of his head so that his neck is well supported.
And look at the neck, make sure it's in a natural position. And then the remaining pillow, you want to take it, once you've pulled the lower arm out and made it in a comfortable position.
And this can be, you can put it in any position. That's a nice, comfortable position. Think of how you are when you're in bed, what's comfortable for you, and that's what your patient will probably like.
And this allows the arm to drape over and have something to lean into. And again, it lifts the shoulders, or it lifts the elbow that expands the lungs for better breathing. So this is a side lying position from the back, and he's well supported.